So for the people who can use CPAP, more power to them. It takes a lot of discipline, and I certainly don't want to interfere with that. If people are doing well with their CPAP unit, let's keep them using the CPAP unit. But for so many people who simply can't, or those who won't, use CPAP, there are some options. Surgery, by the way, has been considered, and there are some surgical options available, but we've been somewhat disappointed in the results. It can be fairly major surgery depending on what's being done, and typically surgical procedures are no more than 50% effective. For someone with serious sleep apnea, a 50% improvement just is not enough. So what first came to mind to some practitioners, about 1975, were mandibular advancement devices. Now, these are devices that fit in the mouth that historically were used in orthodontics for children who have a small jaw. The attempt was to bring the jaw forward and keep it there until it grew into a new and more correct position. This kind of device also brought the tongue forward. When you bring the jaw and the tongue forward, the throat will open, and therefore you accomplish the same kind of effect as you do with CPAP.
Okay, wow. And I believe that you have an example here, so that's really nice, and also a few diagrams on that we'll share with our viewers also. But my next question, if you are determined that you do have this, how do people determine if they're candidates for the oral and or appliance therapy?
Well, that's a good question, and to know on your own is pretty difficult. You really need to have an examination done to determine if, first of all, the structures in your mouth are appropriate for an oral appliance. Solid teeth are essential. People with periodontal disease, meaning they have loose teeth, tend not to be able to wear an oral device. People who are missing teeth can't wear this particular kind of device, and we sometimes have to make a different sort for those people. But the most common kind of device simply requires a good solid set of teeth, a jaw that you can protrude. That is, some people will have a TMJ problem and they simply can't move their jaw very much. And you have to be able to at least push your chin out a little to make this happen. And we have to be sure that there's no other obstruction. For example, some people have large tonsils. And if the tonsils are so large they're practically touching each other in the throat, that needs to be dealt with. And the oral appliance simply isn't going to do the whole thing.
Okay. So is there downsides to the oral appliance therapy?
Well, there are only three disadvantages, really. The first disadvantage is that for the first few nights, people tend to have a lot of saliva.
Okay.
That's simply because there's something in the mouth. After a few nights, the body learns that is not food, and then drooling at night ceases to be a problem. In fact, people may have more of a dry mouth because they're breathing better at night and getting more air through.
Okay.
Second disadvantage is the appliance is made to fit the person's teeth as they are. So if they have major dentistry done, if they decide to have orthodontics or veneers or crowns or bridges done, then they might need a new appliance.
Okay.
For that reason, people have to take the appliance with them to every dental appointment. So even if they have something minor done, the dentist can try the appliance in over that new filling or restoration that they would do and make sure it fits.
Sure.
Third disadvantage is that the appliance actually holds the jaw forward overnight. And you can see that on this little model. Not everyone's jaw has to come out this far, but when the jaw spends the night protruded, in the morning it might stay there for a little while.
Sure.
If it stays there more than 5 or 10 minutes, we'll make a little device that encourages the jaw to go back. People will wear that in the morning until their bite comes back to normal. And some people will have some permanent bite changes with the appliance. Usually they're very small. They're on the level of my bite feels a little different, but I'm sleeping better so I don't care. Some people do have larger bite changes, and then we have to treat that separately. So that's probably the largest single concern about using an oral appliance, is whether the bite will change permanently.
Okay. Well, it looks a lot similar to those of us who have bleached their teeth. You know, it has the actual coating over it, but I know that, you know, when you do that, when you have that done by a dentist, each individual tooth is has the air for the bleaching in it. But it does remind me of someone who plays hockey or any sports that has a mouth guard. It's pretty simple.
In general, it is. And if I take it off the model here so you can see it a little better, I think that might produce a little better information as to what it's like. It is like two bleaching trays in a way, but it's a sturdier material, and it fits the teeth more accurately and more tightly. And it's very durable. In fact, this kind of appliance typically lasts for years, unless somebody lets the dog get it. Dogs love these things.
Yeah.
So there's an upper unit and a lower unit. They snap over the teeth securely, and these straps on each side keep the jaw forward. When the jaw goes forward, the tongue goes forward, and when the tongue goes forward, the throat gets bigger.
Wow.
So it essentially does the same thing as CPAP, but it does it mechanically instead of doing it with air pressure. This also has a couple of advantages in addition to what CPAP can provide. For example, almost universally, people with sleep apnea or snoring have a tongue size problem. It's almost like the tongue doesn't really fit inside the mouth. And it's not necessarily that the tongue is large, maybe the mouth is small. You can see that if you look in a mirror and stick your tongue out. You might see little dents around the edges of the tongue. That indicates the tongue's being crowded, and it's picking up impressions of the teeth simply through normal posture. When the tongue is crowded, it essentially bunches up and back. It goes into the throat and becomes part of the obstruction. So the appliance is made with little platforms, and I don't know if I can show you those very well, these little green platforms that are inside it. And we can make those any height we want. By putting the platforms in, we can essentially make the mouth taller. Therefore, there's more space in here for the tongue to sit in proper posture. We also build small contours into the appliance too, gentle shapes on the inner side where the tongue rests that guide the tongue to sit up and forward toward the roof of the mouth and out of the throat.
Sure.
So those are the ways it works.
Well, that looks a lot more convenient sleeping-wise, and even for those who have a concern about a gag reflex, that obviously wouldn't do that, and it would be very beneficial for yourself and also your partner.
Exactly. We get as much gratitude from spouses as we do from patients, I think.
Okay, yeah, I can see that too.
And gagging generally is not an issue with the appliance. People will gag if they're obstructing, if something's threatening their throat.
Sure.
And if people are having the throat open so they can breathe more freely, gagging tends to become less of a problem with the appliance than it is without it.
And that would be so much better than having the external on, over the actual whole base, and you can actually move about, because I know I'm a tummy sleeper too, and you can get a good quality of sleep. Well, I think everyone's going to want to sign up for one of these, and so I know I would, or I would for my spouse. So what is the total cost of something of the appliance therapy?
It depends a little bit on exactly what has to be done for any specific person, but typically doing an examination, taking the necessary x-rays, because we need to look at the throat from the side and see the contour of the throat and see if there's any other obstruction that's going to be a problem. And we also take x-rays of the teeth to be sure we're putting this on solid teeth, and x-rays of the joints, the TMJs or jaw joints. We don't want to hurt anybody by putting an appliance in their mouth. Then the appliance itself, and then follow-up appointments. Typically, people will have at least 2 follow-up appointments. The grand total is usually in the vicinity of $3,000, and generally that's covered by medical insurance, not dental insurance.
Okay, and to get back your quality of life, because I know sleep is so important. It's probably the #1 cure for everything that we are entailing, and in this society we all seem to push ourselves a little bit more and getting between 5 to 6 hours of sleep a night, and if you're not sleeping well, then you've got the risk of, as you mentioned, the memory loss and all of that. Dr. Hackerly, you have a couple of graphics that I'd really like to show our viewers. So in regards to when you're sleeping, you're talking a lot about the airway and the obstruction. So I believe that if you could go ahead and show them what you were referring to.
Certainly. This particular one is a diagram of someone with an obstructed airway. Now, you can think of throat or airway. They're really the same thing, essentially. The obstructions in the throat can come from different areas. Tonsils often are an obstruction. Simply having a small throat is an obstruction. The largest problem in obstructive sleep apnea is the tongue itself. If the tongue doesn't have enough room in the mouth, or if the other structures are intrusive, during sleep the muscles relax and the tongue tends to fall toward the back of the throat. And you can possibly see that it's, in this case, obstructing airflow. Now, CPAP units produce air pressure that essentially inflates the throat and pushes the tongue forward and the other structures out of the way to make the throat bigger. The oral appliance does the same thing mechanically, but with this other diagram, you can see how, hopefully you can see this, that the jaw goes forward and the tongue goes with the jaw, therefore the throat gets bigger and air is free to flow through the throat. Just a small increase in throat diameter can make a dramatic improvement in airflow. I won't bore you with the physics of this. I was a physics major before I went into dentistry.
Okay.
But the net result is that if we can increase the diameter of the throat by only 15 or 20%, we can reduce the air resistance by half. So it's not that we have to create a giant throat for people. We simply have to get rid of the obstruction so that the air can move past.
Well, that makes a lot of sense, just something that trivial, you know, just to actually, when I move my husband's pillow and it moves a little bit, then of course we all have a tendency to sleep and snore. And when we're snoring, you know, then I move the pillow around a little bit and then it seems to give him a little bit better airway.
Posture is important during sleep, and the diagrams are set as though the person is sleeping on their back. That's really not a good sleep position. On your back, gravity tends to drop the tongue backward, and that closes off the throat more. Sleeping on your side is better. Someone who's slept with a snorer probably knows that if they can get that person to roll onto their side, their snoring will improve or at least diminish. Now, we should not minimize the health effects of snoring either, for that matter. Even though snoring is considered a cosmetic concern or something to be embarrassed about, it actually is a health concern. People who snore every night have, on average, over 200 headaches a year. People who never snore have, on average, only about 12 headaches a year or fewer. Now, those are only averages. That's not true for everyone. But it's clear that snoring itself certainly is a health problem and contributes to chronic pain.
Wow. And to know just if you could sleep well, you could take care of yourself a little bit better, and also to prevent some of these onsets that may occur with you too. So, well, I guess we've already run out of time and we're at the end of our session. So I want to thank you so much for joining us, Dr. Hakula. It's been a pleasure.
Thank you for having me.
Yeah, and to get this great information out to the viewers. Be sure to tune in again for other shows of Knowledge for Wellness to enhance your overall understanding, and visit my website at www.knowledgeforwellness.com. And I hope we have provided you with more knowledge to benefit you and your loved ones. Until next time, be well and goodbye.
Over time you've healed so much in me, and I am living proof that although my darkest hour had come, your light could still shine through. And at times it's just enough to cast the shadow on the wall. Though I am grateful that you shine your light on me at all. Who am I that you would love me so gently? Who am I that you would recognize my name? Lord, who am I that you would speak to me so softly? Conversation with a love most high.